Most people believe regular health checkups are always a smart move. But what if I told you that after a certain age, some of these routine tests could quietly endanger your life? Shocking, right? It may sound counterintuitive, but not every test or screening is risk-free, especially as we get older. In fact, some of the most common medical exams offered to seniors can lead to false alarms, unnecessary panic, and invasive procedures that cause more harm than good. This isn't a scare tactic. It's a reality that more healthcare professionals are waking up to, especially those treating patients over 70. The medical field is undergoing a quiet revolution, realizing that blanket testing isn't just outdated, it can be dangerous. In this eye-opening video, we'll walk you through 5 routine checkups seniors should seriously reconsider, tests that even seasoned doctors often refuse for themselves. We'll unpack why these screenings are still widely recommended, uncover the hidden dangers behind them, and explore safer, smarter alternatives that protect your health without compromising your quality of life. Because after 70, true wellness isn't about doing more. It's about choosing wisely. If you care about your well-being, but also want to avoid being overtreated, overmedicated, or overwhelmed, this video is for you. We're not here to scare you. We're here to empower you with knowledge, confidence, and clarity. Let's begin. Number 1. The colonoscopy trap. Colonoscopy has long been hailed as the gold standard for colon cancer prevention. But after age 70, especially if you have no symptoms or family history, this once life-saving test can quietly morph into a risk-laden ordeal. In your 50s or 60s, it might have made perfect sense, but beyond a certain point, it often leads to more trouble than benefit. Unnecessary stress, invasive follow-ups, and even hospital stays. Why? Because the procedure itself is intense. It requires a harsh bowel prep, powerful sedation, and the insertion of a long scope deep into your intestines. That's taxing on anyone, but for older adults, the risks skyrocket. The prep alone can cause severe dehydration and electrolyte imbalances, both potentially dangerous at this age. Sedatives linger longer in the aging body, increasing the chances of confusion, falls, and even hospitalization. But here's the real concern. Many over 75 patients are subjected to surgeries or treatments after benign polyps are discovered. Polyps that might never have posed a threat. These slow-growing growths can take 10 to 15 years to become problematic. If you're already in your 70s or 80s, those years may simply never come into play. Yet the mere discovery often sparks a chain reaction: fear, biopsies, repeat procedures, and even partial bowel removals, all in the name of prevention. But when the risk outweighs the reward, that's no longer prevention, that's harm. Take George, an 82-year-old friend, sharp, independent, thriving. He was talked into a routine colonoscopy despite having zero digestive complaints. The prep left him severely dehydrated. After the procedure, groggy and disoriented, he fell at home and fractured his hip. The scope, it found nothing. This isn't about blaming doctors. They're following their training, but medicine is evolving, and so should we. If you're over 70, symptom-free, and have no family history, it's perfectly okay to decline a colonoscopy. Today, safer alternatives like non-invasive stool tests offer effective screening without the risk. More testing does not always mean better care. After 70, better care means wiser care. Less intervention, more intention. Being cautious isn't neglecting your health. It's respecting it. Number 2. The full body scan mirage. The idea is tempting. A machine scans your entire body, detects hidden dangers, and saves you from future illness. Sounds like smart prevention, right? Not quite, especially for those over. These high-powered scans, CTs and MRIs, don't just spot real problems. They also detect harmless blips known as incidental findings. Small nodules, tiny shadows, most of them meaningless. But once discovered, they set off a domino effect of anxiety, further testing, and even surgery. And here's the kicker. Many of these follow-ups are unnecessary. For the older body, that's not just inconvenient, it's dangerous. A simple biopsy at 45 might be no big deal, but at 75, it can lead to a collapsed lung infection or months of recovery. Even lying still for the scan can be exhausting on arthritic joints. The emotional toll is often hidden, but profound. Seniors begin worrying about things that may never happen, robbing them of peace and presence. Take Betty, 78, active, happy, no health issues. At a local fair, she was offered a discounted full-body scan. The machine picked up a tiny kidney lesion, harmless and asymptomatic. But the word lesion caused panic. Within weeks, she was in surgery. Months of recovery followed, and she never bounced back to her old self. This is classic overdiagnosis. And full-body scans, they're rarely covered by insurance. You pay out of pocket, thinking you're buying peace of mind, but you might be buying a lifetime of follow-ups. Responsible aging means trusting your body, listening to how you feel, not just what the screen shows. Remember, not every shadow deserves your energy. If this resonates with you, comment 10-2 below and let us know. And don't forget to subscribe for more empowering insights. Number 3. The cardiac stress test conundrum. The treadmill stress test, a mainstay in heart screenings for decades, pushes your heart and monitors how it performs under pressure. Sounds logical, but once you're over 70, this test becomes a double-edged sword. Here's the issue. In older adults, it often shows false positives. Arteries naturally stiffen, blood pressure varies more, and heart rhythms change, all normal aging, but the machine interprets these as warning signs, triggering a cascade of unnecessary tests and procedures. These include angiograms, catheterizations, and even stent placements, procedures with serious risks in seniors, bleeding, kidney damage, strokes. A test that was meant to just check can land you in the ICU. Meet George. Yes, another George. A healthy 74-year-old retired bus driver. He had zero symptoms, but his doctor ordered a stress test, just to be safe. That led to a cardiologist, an angioplasty, then a severe infection, ICU stay, and 6 months of rehab, all from a test he didn't even need. Leading geriatric and cardiac experts now advise against routine stress tests in symptom-free seniors. They don't prevent heart attacks, they don't extend life, but they do create unnecessary fear and treatment. If you feel fine, no chest pain, no shortness of breath, no unexplained fatigue, your heart may not need testing. What it needs is movement, healthy food, social connection, and calm. Walk daily, manage stress, eat well. That's real heart care. Sometimes the wisest action is saying no, not because you don't care, but because you finally understand what truly matters. Number 4. The hidden hazards of repeated colonoscopies. Colon cancer is scary. It often has no warning signs until it's advanced. So it's no wonder colonoscopies are praised as preventive miracles. But past age 70, this test might do more harm than good. The procedure isn't just uncomfortable. It's risky. Sedation in older adults can linger, leading to memory fog, confusion, or even long-term cognitive decline. Bowel prep dehydrates you, messes with electrolytes, and can trigger dangerous falls, especially at night. The most overlooked factor. Time horizon. Colonoscopies are meant to find polyps that could take 10-15 years to turn cancer. But if you're in your late 70s or 80s, and past screenings have been clean, the likelihood of benefit is very low, while the risk remains real. Consider Eileen, a 78-year-old former school teacher. Her last 2 colonoscopies were clear, but her doctor recommended another just in case. During the procedure, her colon was perforated, a rare but serious complication. Emergency surgery followed. A month in the hospital. She survived, but never fully recovered her strength or independence. This is the price of unnecessary procedures in later life. We must shift from autopilot to intentional choice. Yes, be vigilant about symptoms. Unexplained weight loss, blood in stool, persistent abdominal pain. But if you're symptom-free with a clean history, another colonoscopy might not help and could hurt. Protect your independence. You've earned it. If you're still with us, drop IN4 in the comments. And please subscribe. Your support means the world to us. Number 5. The misuse of cardiac stress tests. Yes, we're bringing it up twice, because it happens that often. Heart disease scares people. Stories of sudden death feed our anxiety. So we chase reassurance through stress tests. But for seniors without symptoms, these tests are often a trap. Age-related changes show up on the test and are misinterpreted. One abnormality leads to more scans, then catheterizations, then stent, and then come the complications. Take Harold, 76, healthy, active, symptom-free. His doctor ordered a stress test. Out of routine, that turned into a stent placement for a non-obstructive issue, and then internal bleeding from blood thinners. Months in recovery, because we've been taught to fear silence in the body, to test everything. But past 70, health isn't about finding and fixing every flaw. It's about preserving joy, clarity, and strength. Today's top cardiologists agree. Skip the stress test. Unless you have symptoms, it won't prevent a heart attack or prolong life. If you feel fine, it might just drain your time and energy chasing ghosts. Focus instead on lifestyle. If something changes, new fatigue, dizziness, pain, then yes, get checked. But don't let fear push you into a machine when your own body is already speaking clearly. Getting older doesn't mean giving up. It means getting smart. You've earned the right to pause, reflect, and ask, is this test for me or for someone younger? We live in a world that glorifies more scans, more pills, more interventions. But the true wisdom of aging is knowing when to say enough. Modern healthcare often treats you like a machine. Test this, fix that. But you're not a machine. You're a person with values, with goals, with a life worth protecting, not just from disease, but from the system itself. If this video shifted your perspective, made you question something, or gave you new clarity, then it's done its job. Saying no to a test isn't neglect. It's self-respect. It's weighing the risks, trusting your intuition, and choosing peace over panic. So talk with your doctor, ask smart questions, and remember, your time, energy, and comfort are priceless. You've earned the right to live these years on your terms. Thank you for spending this time with us. If something in this video helped you, please comment below. Let us know what resonated with you most. And if you found this valuable, like, subscribe, and share. Your support allows us to keep creating empowering content for wise, thoughtful aging. See you in the next video.